At this time, I want to thank you guys for being here. As is typical, I'd ask if you please silence any electronic devices that you have, and we will work through these topics together. It's good to see you guys, and superintendent and staff, thank you. We've got a couple of items to go over, or really one item with a couple of parts to it with regard to what we're looking at with regard to health care and health insurance and health benefits in our district. So, Melba, I'll turn it to you.
And I'll turn it over to Todd and the team.
Yeah, I'm going to actually be turning over to your Ken
I guess it's coming back to me now.
It just keeps going around.
But I just want to share with you. I just want to share with you, staff has been working hard at looking at options, how we can control healthcare costs here in this district. So I think you'll be pleased to see that we are doing our homework. And we'll share that with you here shortly. Ken, Lauren, do you want to
Distribute.
Have a copy of the PowerPoint presentation.
Thank you.
It'll be on the screen as well as copies for you to do.
Yeah, I'm going to just leave some around that way.
This is labeled for Mr. Wheeler.
Well, thank you for this opportunity. We're excited to be able to share this information with you that we've been gathering, working to gather, and to better understand what options we may have or what experiences others are having in doing some of the things that we're looking at. Will be our agenda. The first page there is our agenda for what we'll be covering this afternoon, controlling our healthcare costs and what. Just kind of briefly reminding you of what we're currently doing or what we have done, just some of the information we've gathered from our neighbors, what they're doing, and talk a little bit with you about some potential partnerships. Then moving forward and possibly implementing a district sponsored healthcare clinic, and why would we want to consider a clinic? Based on some of the information we were gathering, some services that we would anticipate being able to provide in that clinic, and then just some potential benefits that we're hearing about and having some of the successes, I guess, that others are experiencing with that process. Okay. Just like I said, briefly to remind you what we're doing. This fall, back in October, August, September, October, with our new plan design changes, we implemented a high-performing provider network. We have about 85% of our employees that are currently enrolled in that high-performing network. We're not the only employer in the area that's implemented this type of program. Disney and Orange County Public Schools also rolled out similar network or the same network, and attending a couple of conferences over the last several weeks. These high-performing, more tightly managed networks are definitely on a lot of employers' radar right now. So it was a lot of discussion about those type of programs and how they could impact or the networks and how they could impact our costs of our programs.
Can you just define what is high performing? What does that mean?
It's a tighter managed. It's not every doctor in the yellow pages. Basically, they're looking at outcomes. They're looking at the offices that are.
Who's determining that?
This goes back to the conversation we had a number of months ago with regard to who is in our network and which providers.
Yeah, through our third-party administrator, Cigna. That's where our network comes through.
So is it truly high performing, or is it accept payment that we pay?
It's a combination.
Well,
There's cost factors as well as quality of care factors, if I remember from our previous conversation.
Mm-hmm. Yes. During the same time period, we implemented wellness screenings for our employees and spouses of those employees that wanted to be enrolled in our program. We performed 4,629 screenings that will be used for future data comparison as our baselines for data comparisons. We have our wellness program that we've had in place. I'm sorry, we're on page 3.
Thank you.
Our wellness programs that we've had in place since 2007 has been evolving and developing. This is just a few things that have recently taken place. For disease management classes, we currently have a pilot program for diabetes education that we have 19 people enrolled in. That, you know, depending on how successful that is, we would really like to see that type of a program and expand, and also other similar programs for other disease management.
Do we know how many employees we have that have diabetes?
I don't have that off the top of my head, but I'm not even sure at this point if we could get that from.
Are we
the city.
opening that up to retirees also?
Anyone covered under our
Yeah,
plan.
if they're
Spouses
covered.
are in the program as well.
Okay.
We've got a healthy pregnancy program that started last spring. We've had 55 enrolled in that program and 95% compliance in that program. We've recently, this month, started a 10,000 steps walking program. We've got 630 employees enrolled in that program.
Is that 10,000 steps a month, 10,000 steps a week?
A day. A day.
And are we tracking the success of that?
They were given
Pedometer.
pedometers that they can track their.
And out of the 600 enrolled, you said?
Mhm.
How many of them are doing it every day?
It's in process currently. It just started last week.
Oh, okay, just started, okay,
Yeah.
okay.
This is a new program, so they're still doing some training and educating employees, but, I mean, I know the people in our office, as soon as they got their pedometer, they started walking even before everything, you know, just wanted to see where they were at currently, how much they were actually walking, that kind of thing.
I
But
guess
it's-
by the first board meeting in April, you think we'll have some data on that?
We can try.
Yeah,
Yeah,
give it a
definitely.
shot and see what we can
That'd be
find
great.
Mhm.
out. We have mammogram buses, or a mammogram bus that is going to every work site in the district. As a matter of fact, they'll be here at this site on Friday this week. So far, we've done 229 screenings in 17 locations so far this year.
What's the copay for employees on that?
Zero.
Great.
How do they come, is this something the teachers can do during the day or in staff?
They're there for.
Or is it after, I mean, like when the kids go home?
It's during the work.
So we have
day.
people that'll pinch hit for them for a little bit and let them,
Planning time, staff goes here.
And we're letting people know this is with zero copay?
Mhm.
Mhm.
Okay, great.
They do have to meet their qualifications. They have to be 40 years old or have some kind of history, but it's through Florida Hospital. And we had a previous vendor last year that came just a couple locations during the year, but this year Florida Hospital had purchased the bus. So we hurried up and contracted with them to come to every single one of our work locations.
Good.
And through that contract, we're paying for that contract with Florida Hospital, have them come in, I imagine?
Mhm. It's all through our claims data, so we just billed insurance.
We're offering some fitness classes. We've got yoga and Zumba.
Where?
Yoga is over at Tico facility or Alco facility, and Zumba classes, there's a couple of schools that they offer, those different schools throughout the location.
How long have you been doing that?
Zumba for 4 years now,
Okay.
yoga for 2.
Do we know how many people show up on a regular basis?
I go to yoga class and there's like 30 of us every Wednesday, and then we just started our Thursday class at Tico St. Cloud. It might be moving to St. Cloud Middle because Tico St. Cloud doesn't have big enough room to accommodate how popular it's
And do we have
become.
our own PE teachers teaching these classes?
No, not, you have to be certified in yoga, and we actually had an employee that's not a PE teacher get herself certified in
Okay.
yoga, and she started the St. Cloud class.
What about Zumba?
Zumba, there were some employees, but again, not PE teachers because you have to be certified in Zumba as well.
Okay.
But they are district employees.
I know the Osceola YMCA wants a partnership with the school district as well to expand the opportunities for these fitness classes and health benefits that they're providing. And they're also willing to do a discount to the school district employees for enrollment, membership, partnership, anything like that. So you guys will probably want to look into that further as well. Talk with Jake up at.
I think you mentioned that to me, and I mentioned it to Candace, and
Mhm.
she was familiar, had previous dealings with the folks at the Y.
Mhm.
So I'll have to double check, but I think
Yeah, and there's
she
some
was-
new things. They're going through an executive search right now. Right now, the Central Florida Y is kind of overseeing the Osceola Y until the new executive gets put in place, their executive director. But there's a real desire from the Osceola Y to have a true partnership with the school district for our employees, and what their purpose of their obviously organization is, but also complementing in the fact that they're sitting in our backyard. So.
And the other thing to keep in mind, that's a good point, is that we've got a partnership with Florida Hospital. They've got their top-of-the-line #1 first-class gym right here in Osceola County with all kinds of instructors. And maybe, they'd be willing to do something under their existing contract. I mean, they've got resource, I don't know that we want to send people to their gym because that's expensive, but if we can contract with some of their instructors to go, to school A or school B or school C, the worst that'll happen is they'll say no.
They're a great partner with us already on a
Right.
lot of our lunch and learns, so this would be.
And they've got, I mean, if you haven't been to their gym in Celebration it's world-class.
And then just real quick, for the sake of disclosure board, so you know, I sit on the advisory board for the Osceola YMCA, but I sit there because I'm on the school board. They asked a school board member to be there, so just so you know the context of what I'm bringing up. But there's a desire for that partnership, but I want to make sure you know how I know that as well.
Inside information.
Yeah.
Okay, we did again this year on-site flu shots. We provided 894 flu shots to employees throughout the district.
Is there any incentive for employees to engage in any of this stuff? For instance, their premiums will be lower or their co-pays will be lower? I mean, is there anything?
We attached the wellness screenings, the second item there,
Right.
second bullet point. That was, if you had the wellness screening, you were able to enroll in the Wellness Local Plus plan versus just the straight Local Plus plan. Wellness Local Plus had co-pays rather than co-insurance and those kind of things.
Okay.
But these other things we haven't included they're not really included in the incentives at this point.
Well, they get gift cards depending on the program, like the
Yeah.
pregnancy ones, they'll get gift cards to Babies R Us,
Right.
or those, same thing with the diabetes class, now they're gonna get a.
But I'm just
gift
looking at
card.
a lot of this
Not really
prevention
attached
stuff.
to
A lot of
it.
this prevention stuff like mammograms, fitness classes, flu shots. I mean, things like that's all preventive stuff. I mean, pregnancy is a lifetime event. You get pregnant every year, hopefully. But these other things, I mean, if we could find a way to incent people to engage in this stuff, I mean, I don't see, it'll only save us money.
Yeah, rewarding good behavior.
Right.
Just a couple other items on this page. The health information centers, the health kiosks, I don't know if you're familiar with those. They're like the blood pressure machines that you see like in Walgreens or CVS. It's that type of a program, but while you're sitting on it, it will also take your weight, your BMI, blood pressure, and heart rate. So, and we have 12 of those located throughout the district currently. We're adding 4 more. Probably the most heavily used is over at transportation. We actually have one upstairs in the.
Some people use it over there.
Yeah, we have one actually in the break room on the second floor in this building as well.
And so based on the frequency of use, how often does it have to be recalibrated or et cetera?
Come out like every 2 months.
Oh, okay,
recalculate them,
okay.
So we keep them pretty much
So
up
there's a
to date.
maintenance
And then
there's a
employees-
maintenance schedule for them.
yeah,
Okay,
the
so
employees
that's
have
driving
calls
that.
too,
Yeah,
so.
or if they notice something seems out of
That's
kilter,
on a
we
2-month
they'll
maintenance
call
schedule.
us
That
and they'll
makes
come
perfect
out.
sense.
And there's 12 of them out, 4 more coming, and then they're in break rooms? Is that where they're located?
Well, the one here is in the break room, like I said, over at transportation.
What about from a campus? What campus example? Is it in a?
We started out with them in the high schools, I believe, because obviously that's the largest employee population in a high school, and then we were going to the middle schools and.
So all the high schools have them? All 7
I
high
believe all
schools?
the high
Okay, all
schools have
7
them at
high
this
schools.
point.
Good.
And then we were trying to go down to the middle schools and the multi-level schools because of the size of the population of workforce at each of those locations.
Those have been around for about 5 years, the first ones that we purchased.
And then the last thing, but definitely not the least, is we're researching clinics, and we're very excited about what we're hearing and seeing through this research, and just the impact that these clinics are having on the lives of employees, and actually impacting the cost of healthcare as well. Next page, page 4, is we're controlling healthcare costs. Just give you some update on what our neighbors are doing. All of these folks on this list, Polk County Schools, Lake County Schools, Rosen Hotels, City of Kissimmee and City of St. Cloud, we've visited each, well, I shouldn't say that. We've talked with all of these folks. We visited Polk schools, Lake schools, Rosen hotels, had a lot of conversations with the Polk schools, their successes, their things they might do a little differently. If they were starting all over, they have one clinic now. They are anticipating opening a second clinic in August of this year. Lake Schools currently has 3. Their models are a little bit different. Polk Schools, not just doing the critical care or chronic care, but they're reaching out to their employees and they're encouraging them to come, and they're impacting those people that are not going to the doctor on a normal basis. They're removing, the clinics are removing the barriers of deductibles and co-pays and co-insurances and allowing those people to come and receive services. They are able to identify people with chronic conditions. They can reach out to them through the clinic, bring them in for potential treatment, and education is a big part of what they're doing, providing education on dealing with chronic disease.
Do any of these have pharmacies?
They all do, yes, sir.
Okay.
To varying degrees. Some
Right,
of them
sure.
have more limited, some of them are strictly doing nothing but generic drugs. Others are, providing other levels.
When you say, so from a pharmacy perspective, are any of these doing maintenance medications or okay, so they are doing maintenance medications also?
Well, like I said, some of them are, if it's a maintenance medication, it's a generic, they're looking at their like top 10 prescribed, that's may not be, maybe more than that, but they're not necessarily carrying everything, but the ones that they see the most highly utilized in their program, they're trying to make sure they have those. Like in Polk, they worked out an arrangement because they're in a strip mall with a Publix right next door, so they worked out an arrangement just so that they can have more prescriptions in their pharmacy where the things that Publix provides at zero copay or for free,
Right.
basically. They send the employee over there to Publix to
Sure.
get that for free, so they don't have to pay for those and they don't take up space.
Right.
And they can branch out a little bit more and get some other things.
I got a question. On this list, does Polk County, for instance, do they own the clinic and the employees, the doctors, nurses work for them, or are they contracted out with an agency?
They're all contracted out.
All these contracted out?
Well, Rosen is not, but Polk, Lake, City of Kissimmee, and City of St. Cloud all contract out. And the employees, or the doctors and nurses
Work
and
for
all
the
those
contractor.
are
So,
employees of the contractor. yes.
Another question I've got, maybe you're gonna go over it. This is all good. I've got a lot of friends who are doctors. I've been talking to about this, and one of them is involved with some managed care programs. And he said, heart disease and cancer, oncology and cardiologists eat up the most money when someone has a critical condition. I mean, it costs. So are we looking, and I'm maybe getting ahead of myself, of contracting specifically with any local cardiology or oncology providers, and which is not to say they couldn't go to their own. If they go to these contracted ones specifically, outside of Cigna, they contract with us. Are we looking at anything like that to control costs?
That's definitely part of some of these models, especially the Rosen model.
Okay.
But until we kind of make some decisions about where we're going and how elaborate, if you want to put it that way, how elaborate our clinic is going to be, or what services we are going to be able to actually provide, but it's definitely something that we've been hearing about and and observed with
Well, the
Rosen
spooky
group.
number, and Clarence, this is more for your benefit because you weren't here. We had a presentation before you got on the board. Over the last 3 years, our healthcare expenses have gone up 22%. Our revenues have gone up 7%. So obviously, you go broke if you keep on doing that model.
Not a sustainable model.
So, go on, I'm sorry, go ahead.
Ken, I got a couple real quick ones. Just to kind of think about as you're going through that. You've probably talked to the providers, so you've probably gotten mainly very positive feedback. Have y'all done anything with the users to get any feedback?
Actually, Mrs. Luciano actually had an opportunity to talk to a couple of
Yeah.
end users at both.
I went to Polk County and also to Rosen Hotel, and really I sat down amongst them and started asking them questions. And the one thing that they said, that it was just such a great benefit, because at any time they can go there, there is no charge, and they just felt that it was an extreme benefit for them.
Okay.
So they said the doctors were great, you know, the facility was wonderful. So, yeah, we talked to the users, the end users.
I can also tell you that I know April Jackson has also talked to some leadership, some union leadership at some of the other districts that have the clinics, and
Okay.
she's gotten positive feedback from them as well.
I haven't gotten, I mean, I've talked with, in St. Johns County Schools has, everybody I've talked to, the city of Ocoee, everybody I've talked to has got clinics, says it's great. The only thing I've gotten, this is a couple of years ago from the St. Johns County superintendent, who said one of the real problems can be, and has been, they have experience, is the doctor. A lot of it has to do with who the providers are in the clinic. The doctor can make or break it relative to people wanting to go and it working right. So he said they've had one bad doc, and the doc went away, and they got a different doc, and it worked. So
Yeah, to me, for the normal things that you just go to your general doctor, I would use these. If you're gonna tell me I got one cardiologist to pick from, you get into those, and there's pretty big differences in cardiologist and oncologist and.
but to that point,
Yeah.
people don't have to go to the old
Right.
contract.
Okay, I don't know how that works.
Most of the clinics don't get into specialty care.
Right.
It would be, you know, they would, if you got to that point that, you know, the primary care services had been exhausted and you still needed, I mean, not that they're gonna prevent you from going to a
Right.
specialist, but, you know, they would treat you to a point and then hand you off to, you know, someone in the network that, you know, or then you would have access to the current cardiology list and that's in network, so.
And the beauty of the clinic is that they'll follow up with whoever they hand you off with. So when you come back the next time to see them, they'll know what's going on and make sure that you're in compliance with whatever the cardiologist.
It's like
or
an
the-
HMO.
By doing this, does your list of whatever we call them high-performing providers, does that dwindle because there's not enough business, because the business is going to the clinics? I don't know, I'm just,
Not that we've heard about from
Okay.
anybody else.
You mean in the general marketplace?
yeah. Somebody says, okay, you got 7,000 employees, I'm interested to be on the list. You got 7,000, there's only 100 that don't use the clinic.
Right.
I'm not that interested anymore.
But
I don't
not
know.
that we've heard
I-
anything like that. And it's-
April?
Yeah, I need to interject here, and I'm sorry. A lot of the people now that are currently going to the emergency room as their primary care physician would be using the clinic.
These are the first.
And that's what's gonna save us a lot of money.
Right.
Because in reality, they go to the emergency room, they give their insurance, they don't make their copay to the hospital, they're still treated.
Mhm.
So now they could go to a clinic where we're gonna have follow-up.
Okay.
And it
That makes
costs us,
sense.
and it costs us a fraction of what an emergency room visit costs.
Exactly.
Yeah, and let's do this too, because we're tracking time. We're only 5 pages into a 15-page presentation, so let's kind of move along a little bit here as well.
Okay. Page 5, this is just, as I mentioned earlier, some potential partnerships that we've talked to. Osceola County government and the Osceola County Sheriff's Office are currently in conversation with UCF, and the Care Here is their management company. It looks like the county government is going to be entering some sort of a joint use program with the Sheriff's Office facility. Rosen Hotels, when we've talked to them, they've expressed a possible interest, depending on how our due diligence works out, the possibility that they may be interested in doing something on a joint use with us because they have employees that are located in Osceola County.
Great.
Yeah, and Polk has said something similar, you know, because they have employees that roll over into Orange County, as far away as Orange County, that still come back to Polk County to use their clinic. And that might be an advantage to us as well, because we have a lot of people in the Poinciana area that Haines City may be closer for them to get to. So there's definitely some potential there. Through one of the conferences we've recently attended, we were contacted by a representative from the RAND Corporation, which is a nonprofit institution that does research and to improve policy and decision making. They're interested in talking to us about where we're at in this process and how they might be able to impact our decision-making process, if at all. So excited about the prospect. We've got a conference call scheduled with them later this week, so.
Ken, let me interject if I may with the question, where things left off the last time we all spoke about this was the idea of looking for these partnerships with the cities, with the county, with the sheriffs, with otherwise, and I know you're kind of alluding to that, and I know we had requested, I know you followed through on a meeting with the other risk management departments. How is that going? The cities are already doing their thing. What do you see the landscape being with this collaboration that we're all trying to create within our own community, aside from Rosen and Polk, but with our two cities, with Toho, with KUA, with the sheriff's office, those type of pieces?
The two cities are feeling like right now their capacity or their utilization of their clinic is so high, they're concerned about opening it up to 7,000 potential employees and how that might impact the availability of services for their own employees. So there's some apprehension about that with the two groups.
Instead of thinking how much more service they might be able to provide with 7,000 employees.
Right.
Well, yeah.
So so that's not going anywhere, is that
That's-
part?
That's-
At this point, it's not.
Okay, what about with I know the county's on our potential partnership list,
The
what about in
county
that regard?
government and the sheriff's office are pretty much have a commitment to go wherever the sheriff's office goes.
Right.
Basically, they're interested in joining us, but we have to complete our due diligence in order to make the best decision for the school district and bring back a recommendation to the board. So I think they're kind of waiting to see how our RFP process works out to see what, if anything, we might be able to do.
So let me look at this a couple of ways. The cities, are the cities in partnership with one another? Their clinics are doing their own separate thing, right?
City of
So-
St. Cloud is with one management company that has a doctor on staff, and the City of St. Cloud is with a separate company, and they use the nurse practitioner model. They don't have a physician on site.
What about, do we know about Toho and KUA, what they're doing?
Toho has a doctor.
Oh, yeah, I should ask.
They're
Yeah.
with,
They have 250 employees, and it seems to be working, which amazes me they can do this with 250 employees. I can tell you, I sit on that board, and I fight constantly to have them join in with them. I think this whole county should join in.
Well, that's kind of where I'm going, and I may be wrong because this is not an area of expertise for me, but the economy of scale just seems to make a whole lot of sense, and that's, I think, what the board had been saying all along is, instead of having 3, 4, 5, 8 different clinics going on within the community from each of the public sectors coming together and creating that synergy and that cost savings across the board. So that said, let's just say the county and the sheriff's office doing their thing, Toho has theirs, the two cities are doing whatever, we end up doing our own thing. What does the next iteration of that look like where everyone's kind of doing it and then 18 months from now we all have the epiphany that we should have done it together in the first place? How does the melding of that, and I know you may not have all those answers, but how do we then start to bring some
My
of those
concern
things?
is if in 18 months, we've all built a bureaucracy, and once
That's
that
my
happens,
concern.
we will continue to have 3 fire
That's-
departments.
That's why I'm asking.
I want to shed some light on that before anybody answers. I mean, 10 years ago, when we looked at this, one of the issues why cities, counties, sheriff's office wouldn't partner with us, and nobody would come right out and say it. There was a county commissioner at the time who told me privately, is one of the issues we've got that they don't have is we've got a large percentage of our workforce is women of childbearing age. So that's why school districts, like Polk County School District wants to partner with us. Rosen Hotels, I'm shocked, but it's great that they want to. So the people who want to partner with us, we'll partner with the people who don't.
But you don't have to divide it evenly by the number of employees. You can divide it by the types
It's
of care.
about risk. It's not about
By the
employees. It's about
utilization.
risk.
By the utilization.
Right.
Yeah, there's ways around it.
right.
Okay, I'm just telling, that was the.
Yeah,
that
but
was the
there's
thing.
ways around that our healthcare, our population requires more.
Well, and-
I mean, I don't want to do this to ride on, to have Osceola County pay for our.
Sure.
I'm not looking at it that way. at all.
Right, no, I understand that.
Yeah.
In our research, we also showed that the economies of scale don't come in with the amount of members you have, it's just the upstart costs, so the build out.
Okay.
That's how you would save money.
Okay. And you may be getting to a lot of that, so I apologize if I'm cutting you off, but that, to me, that's the key piece of this, and Clarence, you hit it right on the head, is My concern is that we all go down with this idea that we want to work together, but nobody's able to figure out how to bring the pieces together, and then we do it, and then we look back, and now we're like, oh great, missed an opportunity.
But your
And
point, we can
ultimately
partner
the
with Polk
same.
County Schools in Rosen. There's-
Sure, but ultimately the
that's
same
over
taxpayer
20,000.
of Osceola County is paying for a clinic here, a clinic here, a clinic here. I mean, that's
Well,
my concern. So.
Right, and one of the comments that was made in one of the meetings, I don't remember if it was with the cities or with the sheriff's office, but that their concern was if they join with us, and we've got 7,000 employees, and they have, 23, 24, 2,500 employees, and all of a sudden we decide and they built an infrastructure that will accommodate 7,000 plus, close to 10,000 employees, and we decide we're not gonna do it anymore, are they gonna be left with a facility or an infrastructure that they can't support on their own? So that was one of the comments that they made.
That's a good question, but you can solve that one too.
Yeah.
Contractually.
So,
Thank you, Ken.
okay, page 6. Why the clinic? I think we've shared this information with you guys before. Our current statistics show that about 40% of our employees do not visit a primary care physician. And at the conferences, we were hearing them referred to as the medically homeless. They don't have a primary care physician. They're not attached anywhere. 55% of our spouses and 47% of our children that are currently enrolled are not enrolled with or participating with a primary care physician. Healthcare has a reactive approach, and that's not working. Plan design changes and premium increases, as you said already, are unsustainable. Current fee-based system is flawed. Providers are paid for providing service, not improving the health and the outcomes of their services.
Amen.
Page 7, by removing obstacles to care, patients can receive care earlier and decrease exacerbation and lost time. We can eliminate financial roadblocks for lower socioeconomic employees and their families. Several of these potential partners and the people we've talked to have seen actual decreases, as April alluded to, decreases in the utilization of the emergency room, and as you mentioned also during that discussion, that's the most expensive place to have our people entering the healthcare system. So we can really have an impact on
For the flu or for a cold.
the use of that emergency room visits. The CDC has a statistic here that says percentage of Americans age 18 to 64 who skipped or delayed medical care because of cost rose to 15% in 2009, up from 11 in 1997. Page 8.
And my point would be, that is indicative of your first point up here.
Right.
About things,
The 40%.
about it being a broken system, and the way that it's set up is fraught with peril and is never going to succeed the way that our whole society is set up on this medical system.
Yeah. Can I mention the air they're working on it right now? I know it's getting a little warm.
Thank you.
Take our jackets off.
It's all right, there's a cold front coming through.
They're working on it right now. Yeah.
We're not in Boston, it's okay, not complaining.
They know about it.
Thanks, Clyde.
With a clinic, we have an opportunity to reach out to our employees, to promote wellness with our employees and the importance of them receiving screenings and preventative services. We've seen it in some of the ones that we visited, not all of them, but some of the ones, it's a more personal approach to providing health care. We have an opportunity to make referrals for appropriate care. And then another quote, this one from the New York Times in 2012, according to the New York Times analysis of Medicare data released last year, more than twice the number of nuclear stress tests, echocardiograms, and vascular ultrasounds were ordered per Medicare beneficiary in doctor's offices in Florida than in Massachusetts. So give us an opportunity to eliminate those unnecessary procedures.
Because in Massachusetts, they couldn't get to the doctors, too much snow.
We got 5 times the number of people and a lot older population. I'm hoping this is balanced for that in some.
This time I'd like to ask Lauren Haddix, she's the employee benefits supervisor, just to kind of share with you some of the specifics about the clinic and services to be provided.
So in all our research, we've learned that we want to make an investment in our human capital, because that's what our ultimate goal is, to take care of our children, but we have to take care of employees for them to be able to take care of our children. So some of the services that we're looking at is to have primary care that's really focused on improving overall health, not just to treat colds and flus, although we'll treat colds and flus. It's really to target those people with the diabetes, with the heart issues, and coordinate that care for them. We have the pharmacy, like you said. When we talked to Polk County schools, Melba asked if they could do it all over again. They would add x-ray and physical therapy into the clinic. So that's one of the things on our list.
I got a question. Maybe, I don't know if you know the answer to this or not, but out of all of our employees, do we know the percentage that get physicals, but with the physicals are actually getting the blood test to identify if their cholesterol, diabetes, etc.? Do we know what percentage are getting these kind of screenings?
It's part of their physical. They should be able to
So
get that, but the percentage I'll get back to you.
You know, what percentage are getting physicals? I mean, I don't know what that number is, but I'd like to be able to incent those, because a lot of people, you don't even know what they got. And then there's a critical situation happens, and all of a sudden, we're doing open heart surgery or dialysis or whatever, and it'd be nice to be able to get to the point where we can prevent that.
And the clinic will help educate our employees on those results as well. So if they go into the clinic with their results from their normal PCP, and the clinic physician could look at it and take the extra time to go through all the results and recommend some of the wellness programs that we already
If we
have
can
in
just
place.
increase the number of people getting screened, I mean,
Exactly.
what we're dealing with. I mean,
And that's why we implemented the mammograms,
I'm
because
sorry.
we needed to do that.
Yeah.
So, because we're highly women utilizers, when we talked to Rosen and the Metro Nashville Schools was one of the conference that we were at, they were focusing on gynecology as well, so we figured that would be something good for our high women population as well. And then to be able to drive traffic, the school and sports physicals was a recommendation of one of some of the other school districts that we talked to. They said to bring those in so that the parent could see what a good clinic it is, and they'll be better utilizing the clinic in turn, because they saw that their children were treated well. Then we need to incorporate workers' compensation, occupational health, because their expenses we're currently incurring, and this way we could maybe reduce those expenses as well. So it's just moving it from one pot to the other. So benefits for our employees. So like April said, it's to try and get them in because they can't afford to go to the regular doctor. So of course, there's not going to be a copay. There's no co-insurance. There's not going to be any deductibles. The prescriptions will be free or at a low cost, or like Polk County School says, go to Publix because their antibiotics are free. Free labs, free x-rays. Basically, everything that we went over on the previous slide would be free. The nutrition classes, the disease management classes. But one big thing our employees need to know, that everything is confidential. They're not going to share anything with us. It's going to be a third-party vendor that will take this over for us, and we're only going to aggregate data from that. Once we have the on-site pharmacy, it's going to lead to better adherence to medication. Free medication, you're going to take your pills. You're not going to skip it because Christmas is coming up and you need to buy presents instead of actually getting your medication. We'll have greater utilization to clinics, to your point, Mr. Wheeler, and we want to focus on the health and safety on our work site, and also promote healthy behaviors. Then our employees, and this is by talking to other employers as well, that it's seen as a huge benefit, a great recruiting tool, and it helps improve turnover. And we have a shortage of teachers already. This will help keep our high-performing teachers within Osceola County. And then your increased time with a primary care physician will, again, help the quality of care that's performed, because the average length of visit right now with your PCP is probably 15 minutes. The lowest average length in the clinic would be 20 minutes. Sometimes you can stay with them for 40 minutes or an hour if that's what you need for a condition. We want to make it a center for women's health, as Metro County Schools' goal. Since we again have the high percentage of women in our district, we want to make sure that we can focus on women's health. And then we want to address work-life balances, like stress in the workplace, stress at home, behavioral health issues.
What does become a center of excellence on women's health actually mean?
To help women with all medical problems, so it would be gynecology, it would be the mammograms, proper screenings at different ages, all kind of women's health.
I just want to make sure I understood what the term meant.
Yep. And then We want to make sure that everyone understands that this is a value of our investment, not a return of an investment. We will see eventually a return on investment, hopefully in the years 2 or 3, but the healthier our employees, the better the performance review, and if the better the performance review, it could help assist in improving scores.
How much is the investment?
The investment we'll know once we finish in the RFP, so it's the first cost of the clinic itself.
Right, so we're gonna know that right now.
Yeah, we're out for bid right now, so once we have all those analyzed and get the final company, then we'll know the true final investment.
Okay.
Okay. And then back to Mr. King.
Missed the last one, sorry. We just thought this was an interesting slide as we consider potential benefits. This slide highlights the hidden costs that aren't always as out in the open as per this study, the actual healthcare premiums make up about 25% of the total cost, and the majority of the cost is 60% is attributable to presenteeism. And you may not be real familiar with that, but that's another buzzword from these conferences that we were hearing quite a bit in the last several weeks. But that's cost associated with lost productivity due to health conditions. So you come to work, you're really not feeling that great, so it's difficult to perform at your highest level. As we look at these things, there are some of these type costs that aren't as in your face as healthcare costs, but they definitely do have an impact on the total cost of medical care. And Lauren mentioned a couple times the Nashville Public Schools and the fact that they've actually found a correlation between teacher health and student achievement. So that was very interesting information. Last page, we're looking for the right partner. Currently, we're currently evaluating requests for proposal responses. We actually received 9 responses, which we were very pleased about. I don't think we received 5 years ago when we did this the first time. I don't believe we got that many responses. I think we had 2 finalists, but I think we may have 4 or 5 responses at the most. But so we're pleased about that. The review committee includes folks, Lauren and I both. Todd will be serving on that, and several other staff members, and then we'll have union representatives also.
Was the RFP, when the RFP was issued, was part of the requirement based on experience doing this someplace else?
That's one of the criteria. We asked for information, and specifically we asked for, are you doing this with other public entities?
Right,
not just,
right.
Yeah, you can be doing
cities,
it.
counties, right. Okay, but
yes.
So they demonstrated experience with
yes,
this model.
We
okay,
asked
good.
them to provide that information
Good.
In their response. We are anticipating having a vendor recommendation to bring back to the school board on April 7th. Location evaluations with the assistance of the vendor. The chosen vendor will take place, we're anticipating, in April and May, with the potential, we're hoping to have a groundbreaking in June and opening a clinic if that's where we end up, targeting a January of 2016 opening date.
You answered all my questions except for one.
Yes, sir.
The only question I've got still is, what happens to an employee who we cover, because we cover our employees, but they can't afford the premium for their husbands or wife? Those kids and spouses can still go to the clinic, or do they have to be part of a health care plan that we have to go to the clinic? How does that work? You explain.
That's the way it works with the other
So they've got to be part of
employers.
Cigna?
They would have to be enrolled in one of our current plans to have access to
Okay,
the
and if they
clinic.
can, okay, so let's talk about that. So we have an employee who currently can't afford the premiums for Cigna for Johnny and Susie or for their husband or wife, okay? Is there a plan for those family members outside of the Cigna universe that allows them to use this? Or do they have to be part of Cigna? Because that's the key, is that there's a lot of these families who can't, they don't have they're not gonna have that entry because they still can't afford that Cigna premium. So, which is not to say they couldn't afford any premium.
Right.
But we're not offering anything but the Cigna model, which they're administrating, et cetera. So, are these other agencies, do they have a health insurance option in addition to the United or the Kaiser or Aetna?
Not that we're aware of.
Well, I think that we need to, I'd like to see us consider something because, I mean, again, it gets down to the same issue. Those moms and dads who can't afford to put the husbands and wives or the kids on the plan, they still can't afford to put the kid on the plan. Now there's no copay, which makes it a little more, but there's still that monthly premium. We need to consider some sort of another model outside of what we have for those employees. Because otherwise, it's in the same boat. We've got haves and have-nots. And that's why one of the reasons we're doing this, to save ourselves money, but also to make sure that those people who currently, we're talking about professional people, teachers, who can't get insurance for their kids because they can't afford the premium, let's find a way to work with them to take care of their families. I think this is a great step, but I want to find a way for people to enter, not to exclude, not a way to exclude people, because those same people are going to have the same obstacles, and the premiums aren't going down.
Right.
Let me ask. Go ahead.
Well, I was just going to say, the goal, one of the major goals of a clinic is to help slow the continual increase in the cost of healthcare, and then over time. Not saying that it would happen immediately, but, and I think Lauren referred to, return on investment potentially 2 to 3 years down the road. But, over time, being able to maybe expand the availability and make it more affordable, high quality, affordable health care.
But to your point, with the Nashville model, Nashville schools model, you found that healthier teachers, and anywhere you go, happier employees in any environment are more productive. If we can help find a way to take care of these employees' kids and spouses, and find an alternative plan where that plan, this is their option, is the healthcare clinic. I mean, they're not part of the Cigna network. This is, which I realize that model doesn't exist, but just because it doesn't exist doesn't mean it shouldn't exist, and that, you're a can-do guy, Ken. I know you can put something together that you can show us, because you want to help all of our employees, so I'm looking forward to that, and I know you bring that back again in April when you come with that other data.
Let me ask a similar question in a different way and answer part of it myself. To an extent, so we have an employee that's choosing not to pay for the benefits already provided for them for their additional family members. And that employee finds himself in a situation where they need some type of medical attention. As it stands right now, they're going to the emergency room or whatever it is, and they're paying an exorbitant fee, or they're avoiding, or they're avoiding the health care all in and of itself. To Mr. Wheeler's point, but I think in a little bit different direction where I'm sitting, does it undermine what we're trying to do to create a direct pay for the clinic for those that say I can't do it? So, let's say we have all this in place, an employee goes, they're on one of our plans, and there's no copay, there's no deductibles, nothing like that they need to meet. Somebody that's not on a plan, it's still less expensive to go to the clinic than it is to go to an urgent care or a hospital or whatever, but they still have to pay their share, because, they're taking a benefit from the service that are provided that ultimately really are being subsidized by all the other employees that are helping pay for that in and of itself. Does that undermine what we're trying to do if we did that, if we had some, and you may not be able to answer that right now, but if there was some type of a direct pay component, or does that muddy the waters too much to where it completely undoes exactly the purpose of this, which is to drive down our costs in the first place while making sure that we provide a good benefit still to our employees? And that's different, I think, than what you're asking, but it's similar.
The question is, what's the priority? Is reduce the cost of people in the plan, or get more people in the plan? Or C, both?
C.
I know that, but I'm not sure what we, I know what I think the approach was in this. Reduce the cost of the people in the plan.
Do we have an idea of what the percentage is of how many children are in the situation?
47% was in there.
47%, okay.
Yeah, our 47% are
medically homeless.
Yeah, they're not currently using it, or
And it's because of expenses, no other reason, it's just money.
Well, but.
Well,
let
could
me-
they be
let me-
covered by a spouse plan somewhere else?
There is
Yeah,
that.
we don't, there's no way we know that data.
And then there is also, too, you look at that statistic.
That's what I was
and it's
getting at.
18, based on the data that was provided, I think, from the CDC, 18 to 64-year-olds. There are younger citizens that are choosing not to, this is the whole idea of the Affordable Care Act, choosing not to enter into the healthcare arena because they're saying, look, I think I'm young and I'm healthy enough that I don't need to bear that cost right now, and they're waiting till the 25, 28, 30, whatever it was. I was one of those individuals when I was younger. I thought, I'm young, I'm healthy, I'm in good shape, I don't think I really need it. I ran that risk, and instead of paying for health insurance, I was saving up cash in case I ran into a situation. I know that may not be what the normal person's doing, but there is an element of our society that's been looking at healthcare and saying, basically, I'm going to self-insure. And they do that for the first, 6, 5, 8, whatever it is, years of their adult lives, and then they go, okay, now I've got kids, a wife, family, a husband, whatever the component may be, and now it's time for me to, start, living in the adult world where I get these insurances and life insurance and so on and so forth. So I think there is that part. My answer, though, Clarence, I know you weren't asking me, is the first priority has to be to control and lower the cost of what we're dealing with. That has been the 800-pound gorilla in the room, is that based on the models that we're working within and based on the rising costs, we have to do something to try to fix that. The second part of that then is how do we try to help eliminate barriers for others to become a part of that. But my personal opinion is that this piece first and foremost has to solve how do we make sure that we're not increasing premiums while reducing the benefits to our employees and helping get the controls in place that we need. This is part of that. The second part of that then becomes how do we get that other piece, which really gets to your point about ABC, that becomes the C piece, is hopefully, the second or third version of what we're doing through this. We've created a safety net that's big enough that's helping everybody, but we can't solve, in my opinion, is we can't solve all of it in this one fell swoop, short of looking at options and exploring those. I'm always open for that.
I got a question. One of the questions, so if somebody has Cigna, they've got Cigna and they use this clinic, the use of the clinic doesn't change anything for their deductible once they start using the Cigna network, does it?
Correct. If they decide to go outside the clinic and use a provider away from the clinic, it would.
I think a lot of people are going to choose to use the clinic just because if there's no copay, no deductibles. I mean, that's
That's the hope.
That's what we heard from other
There's a
employers.
lot. I mean,
That's what other employers are seeing as well.
I'm sure. I mean, money compensation drives behavior.
And that's the success model that this is built upon. If that doesn't happen, then this was just a futile exercise, and we created a clinic and we didn't create the end result we were looking for, which is additional cost savings that would keep us from having to increase costs or lower benefits.
But I think, to your question, we have to kind of get our hands around what we currently have, and put a clinic into place and see what the impact actually is. If our experience is similar to what we are observing with the folks around us, the goal would be that we would see the costs reduce to our current, which may open up some additional avenues for us to make some, other decisions that could help expand that. So, but like I said,
Right,
at
which
this
could take
point-
multiple forms. It could be lower the amount that our employees are having to pay for their spouse to be on the plan, or it could be leaving that in place and trying to expand the access to, that's the decision we're gonna have to make when we get to the point where there's actually a revenue source to actually make a decision on.
Have you invited any physicians to be on your selection committee?
Not on the review committee, no, we have not.
Is that something you'd consider? I'm not, I just think, these guys they do this for a living. It's something you'd want, that's a set of eyes you want looking at this.
Can I interject?
Yes, ma'am.
So I'm an eye doctor, so I have been.
Ophthalmologist or optometrist?
Optometrist.
Okay.
For the last, since 2002, I've been running optometry clinics. Since 2006, I've ran 4 of them, till just recently I'm giving up my last one. So I think that there's a benefit to have a physician on the panel, because there's certain things, and I don't remember if it was the Polk County contract or the Care Here, I couldn't remember which one I looked at. But certain features on there I thought was quite exorbitant. For example, one of them had the electronic health records to where they were charging, I think it was $1,000 or somewhere around there per employee, that per new employee to come on board. Well, since I started using electronic health records, there has not been a company that charges that. They either charge by provider, because when you have a new provider, you have to have, you know, the NPI number, the EIN number, different numbers that for billing purposes, so it takes a lot of time to set all that stuff up in the program, whereas if it's an employee, all you're doing is going in and giving them a password and privileges. It takes 5 minutes. There's no reason why you would spend that much. So that's just one example of something that, you know, the other city, I can't remember which one, entered into a contract for. When I saw it, this is ridiculous, like, you shouldn't be paying this. So for a regular employee, every time you're hiring a new employee, it's another $1,000 out of pocket,
Right.
which you end up not saving money.
Could you introduce yourself, since they may not know exactly who you are?
So my name is Tu Pham. I actually work with Larry Brown at Brown, Gargan, and Weiss. So I looked at a bunch of these contracts and just kind of looked at the different provisions to have an idea, so that when you guys, if you guys ever have any questions or anything like that, I can actually answer it for you, since I've been doing it for so long.
Great, thank you.
And we're so grateful that you put that contract together for us, so that we can look at it and just start looking at, you know, what are the good things in this contract, what does she feel should be in the contract or shouldn't be in the contract. So that was sent to us.
Are you open to position on the selection committee?
I don't oppose it.
What was that?
Do we?
Are you open to having a position on the selection committee? I mean, they're in that business, we're not.
The only thing is Florida Hospital bid, so we have to make sure it's not a conflict.
So yeah, you get somebody who doesn't have Florida hospital privileges, or doesn't work for Florida hospital. That's, you know.
Go back,
Go to Polk County and get one.
Yeah, you mentioned earlier the makeup of the committee, and it was really just kind of a passing comment, I think, that didn't hit me. How was that made up? I think you mentioned it, didn't you?
Yes.
Yeah.
Lauren and I, Todd, April, I think, Mr. Phelps, and then
I know him.
Barb Gleason from the ESP group as well.
Yeah, I mean, where are you guys right now? So you're currently evaluating the RFP responses.
I'll talk to some docs and see if they're interested, and I'll email you their contact information if they are.
Let me ask this board, is there, I think Mr. Wheeler's point is a good point, I mean, about having somebody on there. Is there any, from you guys seem to be in favor of that?
I'm a pharmacist.
And then I guess, Melba, for your staff's benefit, is there any issue or concern that you would have with that being in place? I mean, I think it's a wise choice.
Not at all.
Okay.
Yeah.
Gallagher Benefit Services also has pharmacists on staff to evaluate that. Do you have doctors as well, Tom, or no?
Yes, we do have a pharmacist on staff as well. We could probably assist with getting a medical doctor if the board thought that was valuable for the process with it, unless you had one in mind as well, so.
I know a few docs I'll talk to.
And I like actually Clarence's idea that sometimes you need to look outside of your own county, and possibly we can find someone from outside.
Somebody that doesn't have a vested interest.
Yes.
At all.
I can find someone in Orange County.
Yeah.
Does it matter what kind of doctor?
Probably, I would say primary care physician, since that's
Yeah,
that's the type of
Someone who
services
understands the
initially
business
that
side of
we
things.
That's
I think that's the comment that,
That's my
I
concern.
think that's what I just heard right now.
I'm sorry, sir.
Yeah.
So who has the business?
Oh, well, I mean, yeah.
Go ahead, tell them.
No, that's exactly what the superintendent said.
I didn't hear it.
A business, somebody who gets the
Someone
business
who's
side,
managed
not
HMO,
just
somebody who's,
Yeah.
you know, a doctor on the
Who
business
has
side of
6 or 7
things.
offices and knows how.
I mean, a
how it
practitioner
works.
can only take us so far
No, you want
in
somebody-
evaluating, I guess, the points that were made earlier. So if you're going to have so you want someone that's independent, understand the business, and is able to go ahead and evaluate the contract in order to get the best value and avoid paying for unneeded services. And what you're looking at in terms of what Mr. Wheeler was talking about is that you want, when you look at the composition of this committee, you want to have somebody from the outside in here to guide it along as well.
Sure, and make sure we're not getting taken to the cleaners.
So just putting it all together, I just kind of said, well, yeah, you want somebody who understands the business, who's a physician, who can see it from both sides to address those issues.
So I think what's going to be important is, number one, thank you for your expertise as articulated by others earlier. I think we all may know somebody that may be a good option, but I think here's the most important thing is that not any one of us need to be pushing who it is that we
No,
want.
just give them names and
Put
phone
names
numbers.
and let you guys work through the details of that.
And if you can find 2 or 3,
I work
that's
with
fine, too.
physicians all throughout Central Florida market on a daily basis, and so I may know somebody from Lake Mary or Heathrow otherwise that might work from Central Florida Hospital, something like that. I don't know. I can't think of any off the top of my head, but you know, if you know somebody, send it to the superintendent and you guys work through it. I think the value is simply that we want somebody there. It can only help make the
Well, I'm gonna
process
reach out
better.
to them first and talk to them before I send it to
You
you.
just have to be free on Tuesday, so.
Tuesdays what time?
9?
In the morning?
9.
Okay.
I have, Board, you may have some as well. I have some other questions when it comes to the process here. We're talking about location evaluation. What does that mean exactly, and where are we at with regard to site selection and some of those?
That's what that means.
Okay,
And
so
we've
that's
already
the
been-
market scan time period. You're looking to try to find something, identify an adequate site.
We've actually been
Just-
looking around at several different properties.
We've been doing this for at least, 3 months?
Right, and I know we talked a little bit
Mhm.
about some options, but I just don't. So we don't have anything pinned down.
Not yet. We're
Do we have a
getting very
short-
close.
Do we know how big
Do we have a
this-
short list that we're working off of, or are we still looking for new
We're
options?
still looking, but there's a couple of
What's
options,
ideal?
very
What's
close
considered ideal? 4,000
to this
square feet,
area.
5,000 square feet?
6,000, 6 to 7 at a minimum,
What's
based
the
on
question?
recommendation.
What
size?
is typically considered the right size for a clinic? I don't know.
Well, they told us 10,000. I mean, 10,000,
Was
because
the
that way
minimum,
that would include, right,
But-
that's the minimum.
Right, and then they actually, well, Polk is currently in about 4,000, and they said that they would add X-ray and physical therapy, which would make it more in closer to the 10,000 range probably. And then, but their new facility that they're gonna be opening in August is about 12,000 square feet.
It was all dependent on the services that we were
Yeah.
bringing in. Also, the location was also dependent on where we would get the highest utilization. Like, for example, putting it close to the transportation department, because we know that, you know, we'll get a high utilization out of that.
I'm just thinking
And
about
also
buildings.
for workers' comp.
There's an old Sonny's
I got it.
on 192 between John Young and like, I mean, it's the old Sonny.
I know
It's
some of them.
west of John, I'm just thinking that building's been
If you
vacant.
ate there a lot, now you have to come back for the clinic.
I just go to the drive-through, Ricky. But no, it's been vacant forever, and the building is there with plenty of
We
parking.
looked at that.
Yeah.
We looked at that, we
I don't
were
know if it
there.
works,
Yeah, it's a little small.
that's not a great
It's too small.
location. but
Too
it's-
small.
Too small.
Listen, if you guys are serving barbecue in the back, I'm there every day. I'm just saying.
Might get more participation.
One other question, and then Mr. Booth, I think you want to make sure you get your answer to your point as well, is.
Well, I'm sorry, I apologize for being late, and I don't want to have people go over the stuff they've already done. I can watch and talk to you guys, but.
Okay. The question I have is, Clyde, when we look at the location evaluation timeline and then the proposed groundbreaking and retrofitting a facility in that short order of time,
Yeah.
what's,
Where am I?
what?
I don't know what that
It says
timeline is.
April to May as far as finding a location and securing a location, and then June as far as being able to do groundbreaking.
But Clyde, the facilities that we're looking at
Right.
have been in the past,
Right.
facilities that have been clinics.
Okay.
We've
So
looked
they're
at a
already.
couple of sites. We're going, Mr. Davis and myself, will be going in the morning to review the one that we're kind of really interested in. Renovations, I'll know a lot more about it tomorrow. We can get it done. Money, you know, you got money, we can get contracts out there and get them
I
done.
got a question, Clyde. The firm's got a continuing services contract for construction. Have they ever built a medical clinic?
Probably. I can tell you
Okay.
that Lake County did that.
But I mean, but, okay.
But they did it with their provider, helping
The
to fund it.
providers are
Oh, they'll do it.
involved,
Oh, they've got.
like
We're
in the
looking at,
design, the layout and design, they will assist in,
Great.
yeah, all
A
those kind of
medical
things.
building right now is a two-story.
Okay, Mr. Thacker.
I was just gonna ask her, as we're doing this look, are we kind of thinking about at some point, or something that could possibly evolve to like a main clinic that maybe has x-ray machines and stuff, satellites that can do
Mhm.
Yes.
the colds and the,
Yes.
okay.
And that's what happened in Polk County. They said they didn't have any x-ray machines, and that's why they're expanding the new one that they're building, because they said sending them out just didn't make any sense. They needed it right there in the clinic.
Can we need space across Jenkins?
No,
Not 10,000.
fully utilized.
Let's just come real quick. Mr. Booth, I know you said you'll get your answers. Where we were was conversation about the partnerships with the county, with the cities, with the sheriff's office. The two cities already have clinics that are operational. The county and the sheriff's office are working with one another, and that's basically where they're going. There has been some interest, and correct me if I misstate anything here, there has been some interest from Rosen about possible partnership with us, and from Polk County Schools possible partnership because of overlapping of where employees and geographic areas. There was a conversation surrounding partnership with Toho, with KUA, with the cities, with the county, and how that would really be the best thing for all of us. But so far, none of that's been able to come together. Did I misstate anything, or did?
That was very concise. That was just, yes.
See, I do listen.
Yeah, that was right on target.
Okay, Mr. Soto, anything additional for you on this?
If I understood correctly, you're gonna find out for us how much more utilization would be to extend these services to spouses and dependents of employees of members that are not covered, correct?
That's a critical piece. Now,
Yes,
But
no?
we don't know the number of that 47% that
Right,
has
that's-
other coverage, and that's kind of where I was getting at in my question.
Well, that
Because a lot of
40%,
things happen.
47% is actually people that are enrolled in one of our plans currently, but are not utilizing the services of a
Exactly.
primary care physician.
Okay.
Exactly.
There's
So
no way
this,
for us to know who's did not elect our
I
coverage
understand.
because of
I
cost.
and so that's what we're gonna find out.
Well, there's no way for us to know that. We can't, I mean, maybe a survey, that would be the only way. Honestly, there's no research data to know why they selected their other plan.
In fairness, we may not find a physician, but we might find an administrator from a physician's group also that wants to participate. I mean, that's something you'll consider, but if you got,
So-
if someone.
So basically, it may not, I mean, if we had a way to manage that and offer, I'm talking about just the clinics here, to the immediate family members that would have otherwise been covered but are not because of the situation where it's not affordable. And I think that's what you were talking about, Mr. Wheeler.
Right, they can't afford the premium.
It may not be a lot of folks, and we could still offer
That's where I
that
was-
through our clinic. The question would then be is what would happen if they need further care? I mean, they started in our clinic and now all of a sudden, there has to be a referral somewhere else. And that's definitely not contemplated as part of that. So,
Yeah, we wouldn't be providing,
Exactly.
like cardiac care, we would not be providing in the
exactly,
clinic.
so,
Right.
see where you,
Let me ask
Get to
this,
that.
because I think this could be important, that the staff has clear direction from what the board's really wanting to get done. So let's go back to our timeline. I think it's important that the staff understand it's the direction of the board, first and foremost right now, to move forward with the RFP review process, the site selection, and getting this clinic underway. That's got, my opinion, board, I'm looking for head nods. The
Yes.
second,
Oh,
the
yes,
second
yes, yes.
version,
Yeah.
the second conversation
Let's let
here
this horse out of the barn.
is how do we deal with these other variables? And that, to me, because there's a short timeline to get this thing done.
They're two
And
different
if you,
issues.
yeah,
Yeah,
they
yeah.
are. And if we start giving mixed messages, that everyone needs to start going back and doing all this
No,
background
no. I
research.
don't-
So, okay, I want to make sure we're all clear.
I think it was clear, and
Yeah.
it's good that you reiterate that. What we're looking at is, what Mr. Wheeler was pointing out to is, let's go ahead and look at that, how feasible that would be, because there's some value to that. I think we all agree to that.
Right.
And it may not be, the numbers may not be as great as, it's hard to even take a guess. I haven't seen anybody even come close to offering what we're really talking about here.
Can you pull your numbers and see how many have got kids and spouses that are not covered with any plan?
It's not mostly my members, it's cafeteria workers
So
and
we,
paraprofessionals.
and those folks, we can do something.
What, does Polk County would have some data on this?
It may
wouldn't
not
they?
be, exactly.
And how that
And
changed
they
all
would be on
that?
Medicaid for that.
And wouldn't it be possible for them to?
Let's get that.
Sorry.
Let's
No,
Mr.
I'm sorry,
Soto
sorry.
finish, and then we'll come
Right,
back to
just, and even for some that are on Medicaid or Medicare, depending on, to be able to still use our clinic, and then, or maybe there could be something that those plans could pitch in or something.
Yeah, we've talked about that as well.
Okay.
Because we have employees that are opt-out, and we might be able to bill their insurance, we don't know that yet.
Mr. Booth?
I was just saying that would Polk County have data on how these numbers all changed for them? I mean,
Yes.
that we could analyze and you could bring back to this board?
Sure. So
Like improvements in utilization for
Yeah,
primary care.
how these numbers all changed.
And did the participants in their plan change?
Yeah.
I mean, they should know that
Participation, the
since they had
percentage
that,
of
they got
medically
another
homeless and
20%.
all
I
that
don't
kind
know.
of stuff.
That would be it.
Over the
I don't know
time.
how you ever get who's not participating. but
Yeah.
you do have who is, and if that's changed, therefore you made a dent.
And I'm gonna assume they don't have a program like Mr. Wheeler was talking about.
No, not that they've shared with us anyway.
I guess, Mr. Thacker brings up a good point. If you could ask, like in Lake County and Polk County, the percentage of participation prior to opening the clinic and how much that's increased since the clinic is open, that's a great point, Clarence. And I'll bet you there's at least a 5 to 15% spike.
Be interesting to see, I have no idea.
So just so that my position's extremely clear, my number one priority is figuring out how to get this implemented. I'd love to see partnerships with the other entities in their community. If that's not going to happen, we need to get this out of the ground. I think we all agree that this is a smart move. It's going to drive to additional cost savings and help create the financial landscape that we're looking for when it comes to benefits. From where I sit personally, the second step, because there's only so much time and so much time you guys have to handle all these details, the second step is how do we identify and work through these other variables that may exist once we actually get here in the first place. That's my opinion.
Yeah, secondary.
Okay. Is that clear?
Yes, thank
Okay.
you.
Good?
Yes.
Thank you.
Addition?
Thank you.
Thank you. Great presentation, information. Thanks for all your work.
Thank you.
Yeah. Thank you.
Thank you, guys. Sorry for being late.
Don't let it happen again.